welcome back to Rooted and Restored. This is episode 4, and I'm here with my stepdaughter,
Callie.
And I'm Lisa Rowe, and we are clinicians at Rooted Therapies. And if you're joining us and you're following the journey, our last podcast was a great segue into what we're about to talk about today. And we had kind of an informal or impromptu therapy session, and it just kind of worked out. So if you haven't looked at it, take a peek. It's a pretty fabulous insight into the work that we get to do here, and just maybe what it might feel like to be in a therapy session. Yeah. So today we're kind of going to invite you into our inner circle, maybe dispel some myths about therapy, share a little bit about a counseling journey, what you can expect, what maybe might be different here at Rooted Therapies, and then we'll kind of see where that conversation takes us. Mm-hmm. So before we do that, it's always important that before we tell people what we know, they want to know how much we care. Mm-hmm. And so Cal, maybe you can maybe just share a little bit about what you've learned personally as you've taken the steps towards your own therapeutic journey.
Okay. I feel like when I first entered my own therapy journey, I definitely had some judgment about it. I feel like going into it as a kid, regardless of how your parents approach it, a lot of times there's this stigma that you're the problem. So your parents are putting you in it. And then depending on how the parents approach it, right, it's here, take my kid, I'm going to go do my own thing, where a lot of times our approach is that we want parents to be actively involved to create change. Because it's a whole family system, not just the child. So I think when I entered it, I definitely thought I was a problem going into it, even though that's probably not what your thought process was. And I don't think I wanted to talk to anybody, so I definitely had a lot of guards up. But through going through the process, it definitely felt good to have a space where there was no judgment, no bias, and you just had your own space to be able to kind of talk about life.
Okay. So some common themes that I hear is you had your own initial kind of stereotype, maybe perhaps not knowing can you trust the process, maybe feeling if it's something wrong with me, I'm not sure I want to talk about it. And maybe just some unknowns about what could be. Okay. So what allowed you to kind of begin exploring therapy?
What do you mean by that?
Well, I mean, I'm just kind of curious that, was it your prompting, you heard somebody talk about their own therapy journey, or did somebody refer you, or what might have kind of grasped your heart or your mind around okay, I'm okay to do this?
Well, the first time I entered it, it was forced. So I feel like I went because I had to. I wasn't super against it from my memory, but it was something that you and dad wanted me to go to, so I did it. And then I think as I got older, I had a lot more recollection or realizations that what I learned actually was helping me when I was in college. And then I would say I definitely had a little bit of guards up about going back, where I didn't prioritize it even though I needed to go back. And then I think eventually I was just I'm ready to start going back and enter a new season of healing. So then I got to a place where I wanted it for myself.
Okay. So what felt forced at the beginning kind of it seems grew into your own interest. Okay. And so for a parent listening today, perhaps, or whoever else might be in the audience, that maybe there might be resistance initially for therapy. And maybe that's more common than maybe we know even. Because when people get to us, right, they're ready for therapy most of the time. But to just maybe say that sometimes as the guardian or the parent or grandparent or spouse, that holding the space to say, hey, this is important, might be the first step for some people.
Definitely. I think I have kids all the time where either they're oh, my friend's in therapy, or therapy's cool, so I want it, or I don't know what's going on, so they're really open and willing for it. And then I also have other kids where parents are they really don't want to come see you, just so you know, and I'm okay, that's fine. So usually in session, I usually always ask that, how are you feeling about therapy? And I'm I love 100% honesty. I was if you don't want to be here, let me know, because then it gives them space to be oh, actually I don't. And then I check in with them at the end, and a lot of times it's shifted, which is really cool to be able to see.
Okay. And I think it's important too to kind of maybe even open up a little bit about the different types of people in our world. And like you being, we follow the Enneagram a lot, and you're an Enneagram 6, which if anybody's listening that knows that, that's the triad of the thinker. But for those of you who don't, it's a great personality test. But maybe we can link to this podcast so that we can, you can take the test, and it types you as one of these archetypes, and then it breaks you into these triads, where there's a feeling triad, there's a thinking triad, and then there's kind of like this sensing triad. You are of the thinking triad. So I'm just curious maybe to explore that a little bit. What do you think's different about thinkers as they might enter into therapy?
Well, I feel like you overanalyze everything.
Oh, okay.
So I think I'd probably think about worst possible case scenario. I'd probably like overthink like, what's going to happen if they touch this landmine? Like, how am I going to approach this? I think I've gotten to a place with like my therapeutic journey where like I don't overthink before going into it. Like I just know I have stuff that I need to deload or like process through. But I think in the beginning I definitely overthought it, or I'm a very big protector. So like I remember going back to like child Callie, like if they touched certain people, I got really defensive, or like I wasn't receptive to like hearing it yet because I just had like those walls up. But yeah, so I definitely think you can overthink so much that you probably also don't go to therapy. Like you could be like, I don't want that, so you might cancel your sessions, or say like, I'm too busy, you don't prioritize it. So I definitely think that can happen as well.
Yeah, and thinkers tend to be introverts. They spend a lot of time inside of themselves processing things, a lot of times not out loud, but it's like having conversations with themselves. So maybe that would be, as we're just kind of stumbling into this, a more resistant kind of experience initially and of course that's your experience, but because that is not a method of communication for you traditionally, you're used to having conversations within yourself, that having therapy for the first time could be really different and really scary.
Yeah, especially if at home it's not prompted to have like open communication or have conversations about hard things. If things just happen and the kid just has to go about it, it can be a lot harder to open up to somebody and process through things if that's not normal for them.
Right. Okay. And so how interesting to be able to tie that together, because now you've learned that actually staying in your head at times is not the healthiest thing for you. And you're learning who your safe people are and navigating that. And so it's taken time, but you've figured out that like, hey, yeah, I need to think, but I also need to think out loud with people I can trust.
Definitely. Which I think you see last week's episode. That's exactly what happens. And it's still a work in progress, but I've gotten a lot better than where I was at one point.
Okay, which is really interesting. And that doesn't mean that there's not other types of people that would face resistance with therapy. I think resistance is common, right? To share your entire whatever experience you're having, if it's a pain point or a relationship dispute or dysfunction, childhood trauma, whatever it might be, it's hard to invite somebody that you don't know into those conversations initially. In addition to how we experience the world, it can create a really, hard kind of, or maybe challenging perspective, or therapy might be kind of something that is scary.
Prickly.
Okay. All right. And so for me, I'm in the feeling triad of the Enneagram. So it's more common for me to want to talk about my feelings, want to express my feelings. And for the most part, this is the client that I often see as somebody who has big feelings and doesn't know how to do big feelings and needs to somewhere to land those big feelings. And so perhaps somebody listening today is that person, and you're vomiting all over your friends, or you're negotiating life kind of everywhere you go, you're saying something or whatever it might be, that maybe that could be a sign that, hey, I need a safe space to talk about this because everybody's giving me advice and I feel overwhelmed as a result of it. And so I didn't face any resistance. I knew immediately when I was facing difficulties in my 20s, I wanted to talk about it because I just knew that I couldn't talk about it enough and I needed a place to kind of unpack all of that.
Do you feel like at any point, like looking back, do you feel like you kind of deloaded on other people so much that it caused any problems in relationships for you, or that wasn't anything that you experienced?
Um, I don't know that I think I had a lot of self-awareness around that early on in my life.
Mm-hmm.
Yes. Early on, I had lots of people in my world, in my teens, and this sort of thing that they'd ask me how I was doing, and we would spend the whole car ride home from practice or whatever, and I would be telling them everything.
Mm-hmm.
But as I got older, I think I went more inside of myself because I was more aware. And in my codependency, I wanted to protect the people that I was with. And so I didn't want anybody to really know what was going on with me because it was very shameful.
Gotcha.
Mm-hmm.
Okay. I think even like tying this in, you talk a lot about having like different levels of people that you go to in your life. So I think even if you are super comfortable going to like your parents or your friends or coworkers or whatnot, it's good to have different levels of contact in your life because you're going to get different advice from different people.
Absolutely. And said another way, we talk about it a lot in here, but one of my favorite metaphors to describe people's capacity for us is through menus, right? Like there's people in our life that are Taco Bell that you're going to go through a drive-through, they only have Pepsi products, and you're not going to order cheeseburgers. I mean, maybe in some Taco Bells, but you're not going to order Chick-fil-A. You're not going to order filet mignon. You're not going to order chicken parmesan. It's a very specific menu and it's limited. And so there's people in our life that are our Taco Bells. There's people in our life that are our Outbacks, right? That we can sit down, we can have a great meal, we can have a good steak, right? And they can give us that space. And then there's people that are like our Ruth Chris, that, I mean, it's 5-star dining and anything and everything you need. And that might be a therapist for some people. It might be a mentor. It might be a parent. If you're fortunate enough, it might be a sibling or a best friend. But knowing the capacity of people that we're around is often very healthy for us, to your point, to know who's a safe space for me and what am I using them for.
And sometimes knowing too, like, if you like catch yourself constantly going to Taco Bell to get advice, right? What advice are you going to get from that person, right? Like if you're always going to your best friend, she might validate you. She might not always like give it to you how it is. She might, but not all the time. So that's where sometimes, like you said, having a mentor or a trusted parent or a therapist can sometimes lay out the groundwork a little bit more for you to do some more internal work, for you to reflect more a little bit.
Absolutely. And so, you know, we have the thinker and the feeler, and let's just stay with the triads. We have the sensor, the person that's getting heartburn and headaches and pain in their shoulders. These are people that experience the world or stresses in the world through their body. And so oftentimes they come to us, or their medical professional, with, I'm having an anxiety attack, my heart hurts, right? We see this often, and they'll go to the emergency room or get a prescription for something that's going on, only to learn that they have trauma in their body. They are sensing the stresses in their world through their body. And so that's an important thing to understand for those that are listening, that if your body is speaking to you, that's how we view it here in our space, that you should listen. And it doesn't always mean that it is necessarily a major medical condition. Sometimes it is the result of stored trauma or pain in the body.
Being able to explore that can just open up your eyes to so much more, right? Because I've had clients that are way later in their life and they're finally exploring what that looks like, or like yoga, or right, the body keeps the score, or certain things like that. And they're like, I had no idea, and I've had this struggle with my body since I was like 16.
It's absolutely true. That is a great book to read too, that oftentimes the first thing I say to a client is like, where do you feel that in your body? And they're like, that's a weird question. And then you start asking, like, do you get headaches a lot? Where's the pain, the stomach aches, and these sort of things? And they say, like, but nobody can find anything wrong. You know, they tell me to take this over-the-counter drug or whatever. And the reality is, after a few therapy sessions, clinical sessions, things sometimes change for our clients. Makes a huge difference.
Yeah, it's just a symptom. But it's just coming up differently for different people.
Yeah. Which is a great bridge to kind of really just then launch into, like, yeah, everybody enters therapy in different places. Some because they're forced, some facing their own resistance in their life and needing to get to it, some with unknown diagnoses or these sort of things. And oftentimes what we notice in our initial consult call is that what our clients are presenting with on that call, or maybe even in their first session, we call it a symptom. So to your point, headache, relationship pain, problems in a sibling relationship, work issues, right? And going on, sleep issues, these sort of things. These are the symptoms that are causing our awareness to say, hey, I need something different. But underneath the surface, we call that the root because we say it all the time. A 15-year-old girl doesn't wake up and go, oh, I can't wait to maybe self-mutilate, right? Self-harm. A 18-year-old boy doesn't wake up and say, I can't wait to hurt my girlfriend today, right? A 21-year-old doesn't wake up and say, I can't wait to be a meth addict today, right? A 25-year-old, I can't wait to experience hurting my child. These are all things that live inside of us as lived experiences, patterns of behavior, right? Vulnerabilities. That's what the root is, that are coming out in these symptoms. Yeah. What kind of occurs to you? Maybe we can break this down. Working with kids, what are some of the symptoms you see?
Fighting at school, right? Bullying, social media, or finding themselves getting lost in video games, right? Parents are just like, I don't understand why they're doing that. Bad grades, can't keep friends, aren't attending school regularly, using substances. And the parents just get to the surface. Why can't you get good grades? Why are you smoking? Why can't you be on time for things? Why aren't you applying for a job, right? But then getting deeper into it, right? Sometimes there's some self-esteem issues, right? Or the parents, how they're able to approach or have conversations with their kids. The kids just want attention, and they're figuring out how they can get it. And if it's bad attention, it's better than nothing.
So you just described the difference between what presents as an issue versus what's really going on. And it could even be divorce, right? It could be sexual abuse, physical abuse, right? There's a lot of things underneath the surface that statistically we know are way more common than what meets the eye at times, right? Something that's interesting. So I just recently accepted a board position for a local nonprofit that works with sex trafficking survivors, and they asked me to do a training. And they said, the reason we need to do this training is because we had one of our board members sit down with a sex trafficking survivor, and the first thing she said was, you don't look like a sex trafficking survivor.
Wow.
Yeah. But I mean, we say that, but how many times have we been in a situation where our stereotypes have,
leaked out?
Yeah. And we neglect to understand that, like, not everything has a look, right? And so when we say that, the training is called, we're going to do what we call a trauma-informed training. But what I want to kind of tail back to is that, like, not everybody looks like what is really going on under the surface. Right. What kind of, like, comes to mind as you think about that?
I guess what comes to mind is social media. So I feel like so many, even my age or younger or older than me, I feel like every generation can struggle with it to some capacity, but they watch these people online and, like, become obsessed with their life or how they live, and they think their life's perfect, and then you know yourself the most, so you know what you struggle with. But what somebody else presents and puts out online, right, is a lot of times their best self. They don't put the vulnerable sides. They don't put what they internally struggle with. So then in comparison, people are like, oh, their life's perfect. Like, why isn't my boyfriend doing that for me? Why don't I have that relationship with my parents? Why don't I drive that really nice car, right? And that's what you see on the outside. And then something huge happens and you find out they're getting divorced from their husband, or they lost custody of their kid, or all these big, huge things. And for you, like the watcher, right, that's like, whoa, how? That's insane. Their life was perfect. No. That's what they were showing, right? So just because of what you see, right, like exactly what you're saying, that's not what's underneath.
Yeah. And so how important that is for those listening, for people that might be considering therapy, interested in understanding that, like, we have become a society that puts our best self, our highlight reel, out to everybody. We don't walk around vulnerable. In fact, so many people don't even really know what that means. And some people would tell you they don't even know who they really are, right? Because there's so many things. And a lot of that is inner pain and trauma from the roots of experiences, right? If you had a mom who never knew herself and had low self-esteem, and she didn't show you how to love and know yourself, what could happen as a teenager in your office?
Yeah. How are you supposed to know what that looks like? Right? You could have a client that comes in that's like, oh, wait, like I do struggle with like eating or what that looks like or what healthy eating looks like. Or, my parents always make comments about, oh, it looks like you've lost weight or you've gained weight. And then they really internalize that. Or they might get out of the car and their mom might be like, oh, your hair looks really greasy today. Bye, have a great day at school.
Mm-hmm.
And then you're walking in and you're like, oh, okay.
Mm-hmm.
My mom just said that about me. That doesn't feel very great. And now I'm going into school with that, right?
Mm-hmm.
Mom has no intention of those things being harmful or hurtful words, but she's not able to have like a conversation and sitting down with her and being like, okay, like, how are we washing our hair? What's
Mm-hmm.
that look like? Let me help you, right? Because mom doesn't have the capacity to be able to do that because she's struggling with her own internal struggles.
Yeah, it's a good point. And for adults or maybe even young adults to old, like the symptoms have just maybe a deeper connection at times, right? Because there's more lived experience, more life experience. It could be financial issues. It could be relational issues. It could be substance abuse issues. It could be other addiction issues. It could be repeated patterns of behavior time and again. That a lot of those things manifest from if they don't get helped and unleashed as teenagers or younger, they just live with us into adulthood. And oftentimes I'm working with a client right now who's like, Lisa, I've already done the work. Why does it feel like it's coming back up right now? And here she is, having graduated from college, very successful, beautiful young woman, but here she is at 25 with a career, and she's like looking back at her experience, and she's like, I thought I already addressed this. And what we talk about is like, as you climb up the mountain, you can see more of what's underneath. And so if we think about like starting at ground level with therapy, you can't really see, but as you start to climb up through life and conquer goals and grow closer to your like truest self, you can look back and there's so much more that's present to you. So what she was able to see at 18 is a lot different than what she can see now. And so what I would always encourage people is like, therapy isn't a destination. Sometimes it's really a journey, right? And to your point, how you described your journey, sometimes it's like, okay, I got what I needed in this season. And, if you start in a new relationship, or if you move to a new job, or if you do the next thing, let's reconsider starting therapy again or checking in.
Yeah, having big life changes, right? Even if sometimes things feel like they're going great, you are going to have a new level of awareness for things. Or sometimes those deep wounds, right? Even though you've addressed them, they're going to like seep out from time to time again because it's something that lives inside of you. You can learn how to manage it, I feel like, and be really self-aware of it. But it always is just there a little bit. And I think even sometimes with kids, right, developmentally, right, if I'm seeing a 12-year-old and they're doing great, they have a lot of self-awareness for what they're struggling with or what they're dealing with. But when they come back at 16, they're going to have more self-awareness of things, or maybe have some more questions or more insight to, oh, my parents got divorced and now these things are kind of piecing together, and now I have more of a developmentally able place to be able to say like, oh, that was kind of weird, or I have some more feelings about that, to be able to come back and be able to like start working on that journey again or have a new level of healing for them.
Yeah, and we talk about like just growing the perspective, right? Like what you start with is not where we end. Yeah, it's really important. And so as you kind of negotiate this, I think it's important for us to even just name that at Rooted Therapies, we aren't really fond of diagnosing people. And maybe we can just kind of open up a conversation about that, because maybe in your grad school program, which was very recent, that was what you focused on. So maybe let's start there and kind of unpack that. But what have you learned from our kind of value of therapy, the perspectives we have about therapy, and
so I guess giving some like insight, like going back to like grad school me, like I had a class where it was just you read case studies and you had to come up with a diagnosis and support your diagnosis. So there was never any situation where you wouldn't diagnose a client. So I feel like it is very heavily taught for us that you do diagnose. So transitioning and coming here, right, you being my supervisor, you don't take insurance, right? So that wasn't something that was common to learn what it looks like to diagnose while being in practice now. Obviously, I learned while I was in school, but so I can't diagnose since you don't diagnose. But then also learning your approach to it and having some opened perspective on why that happens, I believe that that is so much better than sometimes it can seem like just slapping a label on somebody.
Mm-hmm.
So being able to really get to, like we said, we don't want surface, right? We want to get to the root. And I believe like not having to diagnose clients allows you to get to that place with them.
Mm-hmm.
And knowing that putting a label on somebody can stick with them forever, and they can run into roadblocks in the future when you put a really, really hard label on somebody.
Yeah. And I think it's important to maybe open that up a little bit more. It's not that diagnoses aren't healthy. It's not that there's not a place for them. But as we're looking at trauma, and we believe that if there are root issues to our symptoms, like we're going deep into somebody's trauma, and a diagnosis is a manifestation of that trauma. So anxiety, depression, bipolar disorder, these are things that come as a result of rooted trauma. And if not needed or unnecessary, why label somebody with that if we're treating the root issue anyways, right? And now some people might say, but it's because you need certain methodologies. Well, those methodologies exist no matter what the diagnosis is inside of all of our clinicians at Rooted. And so we have a very holistic approach as we navigate situations with our clients. And we believe that our clients have everything they need inside of them to negotiate their experiences. They just need additional support or a facilitated journey to get to that place. Because most people, all they really need is to feel seen and heard in their journey, right? And to know they're not going crazy, right? Now, are there psychiatric issues and things like this, that suicidal ideation? Yeah, at Rooted Therapies, that's not something that we would specialize in. There is medical support for, extreme cases of trauma manifested. And so there is places for this. But for us, we have chosen to really stay in a place of we want to serve the people that are ready to get to the root issues and really resolve what's going on, because without that, everything's just going to keep repeating itself in the symptom space.
And manifesting.
And so something else we've learned is that we serve a lot of first responders and military veterans, people that have early childhood sexual abuse, domestic violence survivors, sex trafficking survivors. And so a common diagnosis would be PTSD. And if insurance is involved, that diagnosis then follows them for the rest of their life. And so if at 40 years old or whenever you're going for a life insurance policy, that PTSD claim will follow you. And unfortunately, due to the nature of insurance and where we are in our world with that, it can have a negative impact on your, how much your life insurance policy costs, much like obesity or diabetes or these sort of things. And so we like to protect, and our clients that come to us like that because they like knowing that their business isn't everybody else's business, especially first responders. Like there's a big stigma in the police department and the fire department. Like you're not allowed to have a lot of, I think it's changing, but at any level, there's still a stigma to say like, buckle up, like you better show up to work tomorrow. You're taking too much self-care time or, and so there's this stigma to say like, I can't let my guard down in front of people that I work with out of fear that I won't be respected anymore. I'll lose my job or so many other issues. And so we also believe in that, like self-protection, being able to have that kind of experience. And I don't think a lot of people understand, right? Because one of the first questions on our intake call is, hey, do you take insurance? And I get it. People need the support of insurance, and we will do out-of-network claims if people want that, but it's not without educating first.
So they know what they're signing up for.
Yeah. And what will likely follow them as they continue this path. Yeah. And so just kind of offering that perspective that like grad school tells us one thing, the world tells us one thing, but lived experience in my space as a 20-year veteran in this world, like this is really where I feel is the safest place to really explore. Because our humanity, we have defense mechanisms. And if we don't feel safe in an environment or we feel like our stuff is getting back to somebody else, we're not going to be able to sit on a couch like this and fully digress into everything we need to. And so it's really important to have that space. And that's what we believe at Rooted, is to be able to hold on to that space.
And how cool is it to be able to like open up a new door, right? That I feel like isn't super common, and to be able to help people understand that and bridge the gap.
Yeah. And I believe that, We already struggle with having open conversations with strangers with this. And so whatever we can do to derail or create openness, we want to do at Rooted, right? Because again, we believe that until you can feel seen and heard and expose everything you need, right? We also believe that until the dark spaces inside of us enter into the light, there's no healing for that, right? And shared with one other person out loud can in an instant feel relieving. Because those secrets keep us sick, right? And oftentimes we hear this, but I think it's important to say this out loud. Like, shame is what keeps us secret, and shame tells us, like, I am bad, right? I am the problem, like you said, where guilt is saying I did something bad, right? It's a very different perspective, but so many of our clients come in feeling shameful because they had to keep these secrets forever. Nobody else would understand. Nobody in their world is talking about it. And so to be able to just share in a space like this can be so therapeutic.
And being able to share for the first time without judgment, and for somebody to just be able to listen and help them pick it apart, right, is such a different perspective, right? Or even approach than they probably in their mind created for themselves.
Yeah. So if we kind of just summarize and then move forward, walking into therapy is not always everybody's favorite thing. And depending on how you see the world, like we shared, will determine kind of maybe even how you see therapy. But to your point, it's worth facing the resistance to just see what's going on. The second step is to understand like what you're looking for, right? And, at Rooted, we have a very specific approach, and there's other therapists and other organizations that do things similarly and some that do things differently. But just knowing what that approach is important, because what research says is that it's not about how much credentials we have or how many, whatever specialties we offer. It's about the comfort level that you have with the therapist and the practice. And so that's really important to do your homework. And we offer to do your homework an initial intake call to be able to ask your own questions for us to better understand your needs as well. And then when offered the opportunity to meet with the therapist, continuing that process of like, can I be vulnerable? Can I get out of my own way? And am I ready to really deal with the root issue versus just the symptom issue? Yeah. So then the next part, I might be thinking about if I was just on this journey from the very beginning, I've done all that work. Now I'm getting ready for my first session. What can somebody anticipate, Cal, from their first session?
Well, for me, I feel like it goes into like rapport building. Like if I, just like what you said, right? If you can't build a relationship with your therapist and you don't feel comfortable seen, heard, right? How are you going to get to the deeper things? I feel like you have clients that come in that like are ready to deload right away. They don't care who you are. They don't want to know anything. They're like, I just want a space to be able to talk, and we're able to honor that. But then also there's people that are a little bit more skeptical or want to know like, oh, what do you do for fun? I especially get like more of those questions with like my kids, or they'll be like, what's your favorite animal? So I allow for space for that, for them to get to know me, or vice versa, because that allows them to feel more comfortable or laugh a little bit, build some rapport for them to feel safe to then say something that's a little bit more vulnerable for them.
Okay, so a first session might be, I want to share a little bit about myself. I'd like to know a little bit about you. And then maybe the bridge would be what's going on in your world to the extent that you're comfortable sharing, right? Because in my sessions, my kind of pathway is that it's really important that I build rapport, but I also want my clients to start building awareness, right? So many times I hear from my clients, like, I don't know what's happened, or they're really kind of spinning in the symptoms and they're just super frustrated. And helping cultivate a foundation of what's really going on here. So we're digging, kind of almost like, looking for that special like ring that's like hidden under the dirt because it got lost. We're trying to dig that out so we understand what's like got us to this place, right? Because we're not going to stay like in like, I'm having communication issues at work. Okay, that's an issue, that's a real issue, but I want to understand like, where did this all begin? And it likely started back with some pathways with your main provider, and what did communication look like, and what are some belief systems and these sort of things. So cultivating that awareness awareness, which for some clients can happen really quickly, and other clients it takes a little bit longer. And sometimes we use what we call our genogram to do that. Maybe you can tell our listeners a little bit about what that is.
Basically, it's a fancy word, I'd say, for a family tree. So being able to whatever capacity the client wants, because we don't give them a model, right? We kind of give them some guidelines on how to structure it, and then we let them run with it. So being able to put 3 generations on a paper for them, if they're married, their spouse can go on there, and being able to go through strengths and struggles that everybody experiences. Sometimes, right, we can put their attachment styles on there. Some other things might come out while you're working on it, or the session might get derailed a little bit because there's something that you see that pops up as a clinician that you really want to focus on for them. And then overall being able to see how patterns play within their family and things that have repeated for them. And sometimes I think clients sometimes know those things, but then being able to see it on paper and see how they've maybe improved over the generations, but how something still is highlighted as a pattern, but maybe it's lessened over time. Or the extreme symptom, like drinking to cope with things, has repeated throughout the generations.
Yeah, and so that's one of our approaches to better understanding the root issues, working with our clients. So our clients can expect perhaps to do that maybe in their first session, as most of our clinicians are really familiar with that. And then we would move into a place of acceptance, right? Where it's like, okay, now I understand what's happened. I've dug that ring out of the ground. I have it. And now I'm looking at it and it's like, I'm accepting it's gold. I'm accepting that it's not a real diamond. I'm accept whatever it is. A lot of times people struggle to say, I have been abused. Or I had a client in here last week that just intuitively I said to her, as you're doing your trauma timeline for homework, if, your neighbor touched you, or she's like, how did you know? And, we work with a lot of similar clients with a lot of similar issues, but for her, she's like, that's weird. But like moving to a place of acceptance, sometimes even just saying that out loud and then saying, actually, I was exploited, or I was abuse survivor, or that shaped how I see sex today, or physical touch. And so that's a really important place for some of our clients to really stay with, right? Hearing like, actually, your dad wasn't perfect, or your mom wasn't perfect. But yeah, they provided for you and you had a home and you played your instrument and you did all these things, but what did it look like when you sat down for family dinner? Did you get your needs met? And then moving to a place of action as a result, which is like, okay, now that you have awareness, now that you've built an understanding and you've accepted that this might be part of your story, what do you do with that now? Like, what are some things? How do you want to communicate? What are you controlling? What's outside of your control, and navigating that? And sometimes, Cal, that can happen in 6 weeks. But other times it happens a little bit slower for folks. What's your experience in that realm?
Yeah, I think that every client's different. And I think once they get to a place of putting action behind things, that's where I feel like, you've talked about things, created awareness, acceptance within session. So now they're going out and putting the action and putting what you've applied in session out in the real world, right? With maybe their coworkers or communication, or then putting boundaries up with their families or different things like that. And then coming back into session and being like, okay, this didn't work, or this did work, or I got triggered when this happened, or I tried putting boundaries up here, but I'm having some resistance, or whatever that looks like. And then it allows you to work through and cultivate different things with them through that process.
Yeah, bingo. Yeah, and I would hope that maybe today somebody listening, might hear this differently, because I can't tell you how many times I've had clients that say, like, this was a long time coming. I should have done this years ago, right? And it had to get to the 3rd DUI. It had to get to the marriage breaking up. It had to get to the child running away from home. It had to get to such a severity level to like move people into crisis. But my encouragement today is that it wouldn't have to get to that place. That right now, right here, if you're feeling compelled, or somebody that might need to hear this message, that start the process. It will alleviate a lot of the stressors down the road once we start doing the work. It might bring some of them up too, which is what we're scared of. But a healthier us, or a healthier me, makes a healthier us, which makes a healthier family, which makes a healthier community, right? And so it's really important for people's journey that they would maybe hear that differently today.
And just taking the first step doesn't mean everything's going to be perfect and you're going to have a lot of roadblocks along the way. But the end goal, right, is going to feel a lot better than what you're sitting in right now.
Yeah. And the last thing that kind of comes to mind is that, you know, we have a very different perspective depending on the generation that we were brought into this world under, right? We have baby boomers who were taught to keep everything in, not talk about their problems. They don't see therapy maybe as a tool. And we have people in your generation and younger who think they need therapy for everything that's going on in their life, right? And so it's my perspective, and maybe we can end with sharing your perspective, but like there's a happy medium where we want to have resiliency, so we don't need to talk to a therapist about everything that's going on, right? But we don't want to also be silent about that because we've seen what that paying forward has looked like. So there is this perfect marriage, and it doesn't mean therapy has to be forever. So if somebody's watching, they're like, yeah, that's my perspective, or I need to, like, it's like, why don't you just check it out and really just investigate what that means for you.
Yeah, and I think that's, you know, kind of going back, or I guess what popped in my head is attachment a little bit, right? Like you want a happy medium where you're not clinging onto your parents all the time, but you also don't want to be so resistant to them, right? That you're not letting them help and guide you. Like you're finding a happy medium, because if you go to your therapist for validation for every little thing that happens, right? How are you supposed to learn? But being able to build a relationship with somebody that you feel safe, you feel seen, you feel heard, and then being able to be like, okay, like I'm doing good right now. Something happened, or I got into a relationship, like some things are coming up. I feel safe to go back to them. And I know this is something that I've tried managing on my own and I can't, I need some extra help, right? But not feeling like you're so closed off to opening up to anybody, because right, we're humans. We thrive with connection and communication. And if we're not doing that and we're only listening to ourselves, our mind can be a very mean place sometimes.
Yeah. So consider yourself maybe having supposed to listen to this today. And if not for you, for somebody in your world. So share this video and maybe it'll offer some insights and perspectives. Thank you for joining us.